Every year, nearly 50,000 Georgians suffer trauma injuries, but only about 10,000 receive treatment at a designated trauma center. Erica Dickerhoof is a trauma survivor, one of the fortunate ones who did make it in time. Erica and her family had access to quality trauma care when they needed it most.
You think of a car accident, I think of, oh, a broken leg. I didn't think this is going to change our lives.
You look at me now and you don't even, like, yo, you weren't in a crash. Because, I tell new friends that I make, and they're like, you don't look like anything happened. I honestly believe that going to the trauma center really saved my life.
On the night of July 2nd, 2003, 15-year-old Erica Dickerhoof was riding with friends when their car spun off the road into the woods. All three were wearing seatbelts, but Erica's injuries were the most severe.
When we pulled up, the police officers had a blockade. It was about a mile from the site. They realized that Erica was in the car.
I don't remember anything about having the paramedics there, them getting out of the car with the jaws of life.
Erica was airlifted to Atlanta Medical Center, a Level 2 trauma center with special diagnostic equipment and a team of trauma surgeons and specialists on call 24 hours a day. Getting to a designated Level 1 or Level 2 trauma center within the golden hour, that 60-minute window after a trauma injury occurs, can make all the difference. In Erica's case, her severe head injury made it a life or death decision.
I truly believe if she wouldn't have made it to the trauma center, she wouldn't have made it. She almost passed away 4 times in the first 6 days. And I do believe that it was all the quick work of everyone involved.
I can say to a T that for certainty that getting her to a trauma center, stabilizing her, making sure all the other injuries were taken care of quickly, it enabled them to focus on the real serious injuries.
She would have just been taken to the local hospital. I don't know if they would have been able to assess the damage that had been caused to her brain. We know of a case, a girl that was in rehab with Erica had a car accident the exact same day, July 2nd, 2003, in Florida, but she was taken to a local hospital, and we've seen her since then, and she is a good year behind how much Erica has improved.
I went to stay in rehab at Scottish Rite, which is Children's Health Care, for 3 weeks. Having them help me, take time to make me back to the way I was before, learning how to walk, learning how to remember things. It was just amazing to see that they can actually help one become better off than they are at that moment.
Erica missed just 3 months of her sophomore year, and less than a year after the accident, the competitive swimmer received the honor of running the 2004 Olympic torch through Atlanta on its way to Athens.
I went through a lot, and a lot of people didn't think I could deal with it, and my mom's like, you don't know my child. I was like, you don't know who Erica is. She's going to be back and running by no time. And then getting in the pool and swimming, I was a lot slower than I was because I lost all my muscle, but my stroke was to the point. I mean, my technique was awesome.
If there were more trauma centers across Georgia, we'd have fewer kids with severe brain damage and with long-lasting injuries, and the overall cost of taking care of them would decrease because they would get better quicker.
Every day on her way home from school, Erica drives by the scene of the accident that changed her life. More than 2 years after the crash, she still faces additional surgeries and therapies, but the outcome of her trauma care is a positive one. The North Cobb High senior is a straight-A student and the homecoming queen who's looking forward to college and a career.
I don't like to look at things on the downside. The glass is always half full. I've been taught to look at the positive side, and I realize when I look at the positive side, I don't remember the bad things. I just remember the good things. And relating that with the trauma center, if they would have saved my life, I wouldn't have ran the Olympic torch, which is absolutely amazing.
As you've seen in Erica's story, when the components of a trauma system work together, the results benefit the patients, their families, and their communities. In human terms, The benefits of improving the statewide trauma system outweigh the costs. An optimal system must be established in Georgia so that every citizen has access to a trauma center. By understanding how trauma systems can optimize chances for survival and recovery, policymakers, community leaders, and the public can make informed decisions about establishing and supporting trauma centers and a trauma system in Georgia.
I truly believe that she would not be here today without a trauma center. And I don't know if I would even live somewhere where there wasn't a trauma center now.